and I would like to give a lecture on the syndromic approach in STI case management, a primer. So STI is sexually transmitted infections, and I'd like to give you a primer to whatever is new and is happening and is useful to your practice. So how are STIs transmitted? First, let's recall that STIs are transmitted through unprotected, penetrative sexual intercourse. So if you have penetrative sexual intercourse with no protection, you can transmit an STI from one person to another. Okay? Mother-to-child transmission is also possible. You can transmit STI during pregnancy. Okay? You can transmit STI during delivery, okay? Like herpes and HPV infection, human papilloma virus, and even after birth, you can transmit HIV. So HIV can be transmitted after birth and through breast milk. HIV only as well, because breastfeeding can be a source for transmitting HIV to the neonate. HIV is found in breast milk, and in some countries, our neonates get most HIV cases because of breast milk transmission. Transfusions or other forms of contact with blood or blood products are also responsible for the transmission of STIs. Now, we have high-risk behaviors. Each person or the person you're talking to or the population might have high-risk behaviors, and high-risk behaviors will definitely predispose one person to get an STI. So personal sexual behaviors which are high risk include the following. If you have a patient who has multiple sexual partners, if he has 5 or 6 or 7 or even more than 20, that's one high risk factor behavior. And then previous STI in the past year. So if they had a previous history of sexually transmitted infection during the past year, that's a high risk personal behavior as well. People who exchange sex for money and for goods, okay? Those who exchange sex for drugs, so the intravenous drug users, the commercial sex workers, okay, these are high-risk personal sexual behaviors and high-risk populations. Also, those who engage in alcohol and drug use. So intravenous drug users, those who are alcoholics, when they are drunk, they do not know what they're doing and they do not recall what happens. And of course, blood transfusion is also a high-risk sexual behavior, a high risk personal sexual behavior, especially if they use contaminated needles and they share needles with one another. So when we do blood transfusion, we do it in the most sterile fashion in a hospital or in a clinic setting, and not just left and right. We also have high risk behaviors, okay, if the partner has sex with others. So for the high risk behaviors regarding to the partner, it is important. If you have a partner who has sex with others, then that's a high risk behavior. If you have a partner who has an STI, beware, because you might get an STI from that partner too. If the partner is HIV positive, then it is also a high risk behavior on the side of the partner. If the partner is a drug user, he or she can transmit HIV or other sexually transmitted STI, sexually transmitted infection, to you or to other partners. And if the partner has sex with other men, that is also a high-risk behavior. In fact, syphilis before was already becoming out of the textbooks. There were fewer and fewer, almost no more cases of syphilis, but with the resurgence of men having sex with men, we now have syphilis back, and most of the syphilis cases are seen in people whose partners have sex with other men. So preventing and controlling STI is easier said than done. We have to do early diagnosis and treatment. Okay. We also have to educate the patient and the partners. We do not just educate the patient, we also have to tell the partners, because if you don't treat the partner, the patient will get reinfected and the partners will just spread their infection all around to whoever partners they have. Promotion of condom use is also important. We are promoting condoms not to prevent pregnancy. We are promoting condoms to stop the spread of sexually transmitted infections. This one you have to tell the patient. And we are to prevent and control STI. We are targeting the vulnerable groups. Vulnerable groups, which include the commercial sex workers, the intravenous drug users, or those who are high risks, as shown in the slides a while ago. Now, there are different approaches to STI case management, and the syndromic approach is what I would like to focus. The syndromic approach is designed to blend the strategies to prevent and control STIs together. So you don't just prevent, control, you also treat. You deliver comprehensive and integrated STI care, and this is currently implemented by the Philippine Society of Venereology. The Philippine Society of Venereology is where I am a fellow of, and that's the society that promotes awareness, treatment, and subspecialty programs for venereology for those who are interested in STI subspecialty. Now, the benefits of the syndromic approach would be the following. First, there is complete STI care that is offered at the patient's first visit. So, the first patient's visit, the patient's first visit to your clinic, you give the complete STI care. That's the syndromic approach. The treatment is more widely and rapidly accessible. You get accessible treatment immediately upon the first consult. The patients are also treated for possible mixed infections by addressing all the important causes of a syndrome. So if you have one syndrome, you are treated for all the possible infections that may cause that syndrome, and that's a benefit. And you're doing prevention and compliance, which are enhanced through education. Syndromic approach is very focused on education, on partner notification, and condom promotion and provision. The main features of the syndromic approach would be grouping the main infectious agents according to the clinical syndromes they cause. And then you use flowcharts and algorithms as your tools. Then treating patients for all the important causes of a syndrome and educating patients, promoting condoms, and you emphasize the importance of partner notification, that they have to notify, they have to inform their partners that they have the disease, so that the partner will also come for treatment and for counseling as well. So here are the 4 STI syndromes with skin manifestations. You have the syndrome can either be vaginal discharge, which can be caused by trichomonas, candidiasis, gonorrhea, or chlamydia. You can have urethral discharge, which is caused by gonorrhea and chlamydia. You can have genital ulcer, which is caused by syphilis, genital herpes, or chancroid. Later, I will show you an example of the syndromic approach of genital ulcer disease. Lower abdominal pain as well is a syndrome where the common cause would be gonorrhea, chlamydia, and mixed anaerobes. So the good thing, syndromic approach uses flowcharts, and the benefits of using a flowchart is that it is very convenient, it is very user-friendly, it's useful for the patient, it's even more useful for the doctor. It can be used anytime in all kinds of health facilities. So whether you're just in a health center or in a hospital or in a private clinic, you can use the flowchart. The flowcharts suggests clear decisions. So is it painful? Yes, there is something to do. If it's no, there is something to do. So most cases do not have to be referred. You can actually manage an STI patient in your right without referring to anyone because you have clear decisions based on the flow charts. And the standard treatment guidelines are established. We use the CDC guidelines, we use the DOH guidelines, and give the proper treatment using the flow charts and at the same time being doctor friendly and being patient friendly. So how do you use the flow charts? Later I will show you a flow chart and how to use it. So a flow chart is basically starting at the top of the flow chart. At the entry point box, there is a patient complaint. You then gather information that's needed for the diagnosis, then make decisions based on the information that you gathered while doing history and physical examination. Then you make your diagnosis. Then you choose the treatment that corresponds to the diagnosis. Then you educate and offer condoms and explore the option for partner referral. You can use all of this. All of these are found in the flow charts. So here is an example of a flow chart I described a while ago. Here is a flow chart for anyone who comes and has a genital ulcer. Doc, there's a wound. I have a wound on my penis and I don't know what to do. I'm scared, doc. Please help me. So here, that is the patient. The patient complains of a genital sore or ulcer. Here is the flow chart, the syndromic approach, and what you will do. First, of course, as a doctor, you take a good history, physical examination, and examine the patient on what the patient really has. So, is there a sore, ulcer, or vesicle present? So it's either yes or no. If there is no ulcer or vesicle present, then you educate and counsel, you promote and provide condoms, and you offer HIV counseling and testing if both are available. The best time to offer HIV counseling is when the patient consults. You never offer them weeks later because they will forget. The most teachable moment is the time the patient consults. So here is your decision for a no. But if it's a yes, you do physical examination and you see a sore, an ulcer, or a vesicle that's present, then it's a yes. Then you check, is it a vesicle or small ulcer with history of recurrent vesicles? So to review, vesicles are fluid-filled blisters. There's fluid inside and they're less than 1 centimeter. Ulcers are depressions. They are depressed. They are depressed lesions, okay? And they're sometimes painful, sometimes painless, but that's the job of the flow chart and the job of the doctor. So do you see a vesicle or small ulcers with history of recurrent vesicles? Does it recur all the time or recur every month, every 2 months, or doc, I've had it 3 months ago? If they say yes, then you do herpes simplex management. Educate the patient, tell them what they have, educate them about what herpes simplex is, okay, that it will not kill them. Most of them, they already have read the internet, they already Googled, and they already consulted Dr. Google, and they know everything about herpes. Educate them, do counseling on risk reduction, promote and provide condoms, then offer HIV counseling and testing if both are available. So this is for vesicles, for small ulcers, okay, with recurrent vesicles. However, if you ask the patient about vesicles or small ulcers with history of recurrent vesicles and they say no, there's no recurrence, this is the first time that this happened, then you will treat the patient for syphilis and chancroid. This is your decision if they say no. So first, you have to educate them about syphilis, educate them about chancroid. Okay, reassure the patient that it is treatable, it is curable actually. Do counseling on risk reduction, promote and provide condoms, offer HIV counseling and testing if both are available. Partner management, you have to tell the patient if they can bring their partner to be treated as well, especially their regular partner, whether it's their spouse or girlfriend or any other partner or boyfriend. Advise them to return in 7 days if necessary, and you'll have to refer if needed. If you see other signs and symptoms, that's the time you refer. Okay, chancroid needs adaptation to the local epidemiology situation. So some areas are endemic or have a lot of chancroid cases, like other countries in Thailand. Philippines, we don't see so much chancroid, so we usually treat for syphilis first. Okay, syphilis is painless, chancroid is extremely painful. So if you could see, this simple flow chart will actually make the doctor competent in making decisions and in asking questions. It will actually also help the health worker, even if he or she is not a doctor, guide them through a patient who has genital ulcers. And most of all, it is patient friendly, it is doctor friendly, and this is the syndromic approach for the flow, or which shows the flow chart for genital ulcer syndrome. Now there are other flow charts, other syndromic approach managements for the vaginal discharge and the syndromes I mentioned a while ago, but this is just an overview of everything. So with this, I hope I have instilled in you the importance of the syndromic management and using flow charts in diagnosing and treating in managing STI patients, because the next lecturers will be teaching you how to take a good history and physical examination for STI patients, and hopefully with that incorporated with the flow chart, with the syndromic approach, you will be able to become more competent physicians. Thank you very much and have a good day.